Hi everyone, Diana Isaacs here. I'm an endocrine pharmacist and a certified diabetes care and education specialist at Cleveland Clinic. And in this video, I want to talk about who should use inhaled insulin. Who is it really for? And the answer is it can be for a variety of people. So it is FDA approved for people, well, specifically adults with type 1 or type 2 diabetes. So what does that mean? Who would be a good candidate for it? Well, when I think about people, I know that not everyone loves injections, and some people really find it just the needle, the idea of the needle, even though it's small, this idea of injecting this needle just really, it's something they're not very comfortable with. And it definitely leads to barriers of taking insulin. And so with inhaled insulin, this actually replaces mealtime insulin. So it's designed to be this fast acting, super fast acting insulin. And so it can actually replace all of those injections during the day for food, for meals, or to correct high blood sugars. A person would still take a long-acting insulin, but at the current time, that's just once a day. And in the future, we'll hopefully have weekly options. So that really helps to minimize all of the injections. Another use case scenario is a person maybe doesn't mind injections. They have no problem with needles, but it's just so inconvenient to actually get the supplies out and give that injection. So I think about like someone's at a dinner or someone's working during the day and it's time to eat lunch, right? And so to give that injection, they have to go out, they have to get their pen. They have to go ahead and make sure that they've got a needle. They have to attach that, dial the dose, remember to do it before their meal, and not just before their meal, really 15 minutes before their meal if they want it to work at the time that their food is being absorbed. And it can be hard to remember to do that or to have the time to do it. And sometimes there's just social pressures of, gosh, I'm in an environment, I'm in a work meeting, I'm at a dinner, people here don't know I have diabetes. And now I have to decide, am I gonna just get out my supplies and just do it here at the table? If not, where am I going to go? Am I going to go to the bathroom and am I going to go in a stall and try to do this? And it's just, right? It's like not so easy and so convenient. So this is a great way, another option to take insulin that can be easier to use, I think a little bit more discreet. And something to understand also is it's not all or nothing. So you may have a person that says, well, you know what? I don't mind. I can inject my insulin. Breakfast time, it's no problem. I have a routine. I get up, I give my insulin, I take a quick shower, I go ahead, eat my breakfast. Great. If that routine is working for you, no problem. Keep it up. But what about lunch? Is lunch working? Maybe you use inhaled insulin at your lunchtime. That can be a good option. Another great option is correcting high blood sugars. We know how frustrating that can be because insulin takes forever to start working. Injectable insulin takes so long. And so, a common scenario that happens is, well, someone's high, they don't want to be high, so they give themselves insulin. They wait, they try to be patient. 30 minutes passes, an hour and a half passes. They're still high. What are they going to do? They're going to give more insulin. But that insulin actually is like working in the system for like 5 hours. So that insulin's still working, and then they keep giving more. And then, unfortunately, what often happens is that crash where it all hits at once. So, with inhaled insulin, it is much safer to do this. You can give it, it's going to come down much more quickly. And actually, with inhaled insulin, it is safe to be able to redose an hour later if it's not coming down. So it really, I think it puts the power in the person's hands with diabetes that they don't have to be told, oh, just be patient, just wait it out. They can actually take action and go ahead and use this as a great tool to help to bring it down. I think so often people just don't think about inhaled insulin as an option because we're just so used to injectable insulin. And so I really want to make sure that people are aware of this option. One tip that I do have, so with any insulin, right, a side effect could be low blood sugar. Fortunately, it's actually a little bit less with this type because it works so quickly and it's out of the system so quickly. But with it being an inhaled insulin, one of the things that can happen is someone could experience a cough. And so, a great strategy to help with that is actually to take a sip of water before inhaling. And then afterwards, just take another sip of water. So just having that water nearby can really help. And in my experience with my patients, usually after they've done it a couple of times, they're like, oh, like they know what to expect. And then they're much less likely to cough. So with that, I do hope that these tips were helpful. And I want to thank you so much for tuning in.